introduce yourself.
I did one where they do
You
the
don't need me.
ultrasound on my veins, and then
Okay,
he got
we're good.
COVID, so we did it over the phone.
I think, yeah.
Okay. Hello,
Hello.
my name is Eric. I'm a firefighter paramedic. I'm full-time with the Oregon Fire Department. This here is Aiden. He is a firefighter EMT. And then Lance over here, he is a firefighter. He's actually not yet. He is still going through training. He's going through EMT basic. And he has not gone through fire training yet. So we're here to talk about what to expect when you guys call 911 for an EMS call. So depending on what the call is, depends on what you're going to get for apparatus. Most of the time you're just going to get an ambulance. So our primary ambulance is at the paramedic level. So what that means is you are getting a level of service pretty much what you are going to get in the ER. So we can do everything in the back of the ambulance as they can in the ER. Our second ambulance, it really depends on who's available. So sometimes it's an AEMT level, sometimes it's a medic level, and sometimes it's a basic level. So what we do when we get on scene, we'll grab all our stuff in, bring it in. So it may take us a little bit once we get on scene to grab all our necessity equipment. Then we'll come in and we'll kind of see what's going on. A lot of things that we'll ask for when we first get on scene is A, what's going on? That's the biggest thing. If you've been at the hospital recently, we'll actually ask for your recent discharge paperwork. The reason for that is it has all your up-to-date medications, it has all your health information, like if you have any cardiac issues, respiratory issues, anything like that. And then we also have File for Life that they have on the back counter there, and what that is another form. So if you haven't been to the hospital recently, it has all your information, so your name, your date of birth, any allergies you have to any medications, health information, and anything else that we need to know. Sometimes too, depending on the call, our engine will also show up. Doesn't really mean anything. It just means that sometimes we just need extra manpower to either A, get a patient down from the second story or up from the basement. And then sometimes we do need the extra personnel to transport with us as well. Then other than that, it all depends on what kind of type of call we go for. So baseline on every patient, we're going to get a set of vitals. A lot of our patients, we're going to put the cardiac monitor on, check the heart rate, check how your heart is beating, if you're in a regular heart rhythm, or are you in some sort of other rhythm that may be causing your symptoms. There's a lot of different symptoms that kind of go with different things. So respiratory can actually mean a heart attack, not just a respiratory issues. Vice versa, I mean, you can have chest pain because you're having respiratory issues as well. So it's a bunch of different stuff that we got to figure out once we get on scene. So once we get your vitals, we'll get you onto our cot. We'll ask you what hospital you want to go to. You have a choice of which hospital you go to. We primarily transport to Stoughton, St. Mary's, Meriter, and UW and the VA. We don't really go to the VA or to the East Side Hospital for UW, just because it's a little further for us. We'll do Edgerton Hospital every once in a while, but we got to get chief approval for that. So then we'll take you to the hospital. It is not a smooth ride. How many of you have been in an ambulance before? So as you know, it's not a smooth ride. Unfortunately, we'll try and make it as smooth as possible. But unfortunately, all the roads around here have a bunch of potholes and stuff like that. So then once we get to the hospital, depending on what's going on, depends on how many people are in the room. Some people, your ordinary visits, you'll have a nurse and maybe a doctor show up, or a couple of nurses. The more critical patients, you're going to have a doctor, a bunch of nurses, a RT, a bunch of techs, and everybody's just going to come in at you at the same time ask all the same questions that we just answered or asked you in the ambulance, and then they'll go from there as well. So, any questions?
How do you get in if somebody's got an emergency and they can't get to the door?
It all depends on where you live. How many of you live in any of the apartments around here? Nobody?
Condo.
Condo? Okay. Some of the apartments and condos, they have what's called a Knox box key. So in our truck, we have a little box with a key. We actually have to put the last 4 of our social in there to get the key out. We'll go to the Knox box, we'll put our, get the main key, and then we can open up your door that way. Unfortunately for homeowners, we are gonna try, depending on what the call is, really depends on how much we're gonna do. If it sounds like something not as serious, we are gonna exhaust all resources. So we are gonna be walking around your house, making sure there's no open windows. If there's an open window, we're gonna try and open up the window, break the screen, come in through the window. If there's no windows open, unfortunately, the next thing is the easiest way is either a door or a window. We will break the door or the window. There are ways that we can actually break the door, that we can actually secure the door afterwards. That doesn't always go as planned. If you got a deadbolt, unfortunately, it's either taking the whole door and we're not gonna be able to save it, or breaking a window. We're gonna try and cause as little damage as possible. If that's the case, we're also calling the engine out because they have a little more tools that we can use to get through a door.
I have given the fire department and the police department my garage door code.
Yep.
Do you look at that, or?
Yes, I'm glad you brought that up. So some people have spare keys, some people have garage door openers. So what we do, if we get that information, we'll send that up to our Dane County 911 center, and they'll put it right in the cab. So what that means is, as we're going to the scene, they'll say, hey, updated information, garage code is XYZ, key is under the potted plant 2 over from the post. So we'll actually see that, we'll actually look at that, and if that's the case, we'll go right to that spot and grab the door code, key, or whatever.
Is there a charge for the service?
Is there a charge for the service? I am probably the worst one to answer that question. The reason why I am not the one is I don't really care about the charge. I am there to treat you, but unfortunately, yes, there is a charge. What the charge is, I have no clue. I know it's a generic, like Dane County has a special rate that they charge, but to give you an exact information on that, I unfortunately can't give it to you. So, yeah.
You call from a cell phone, is the dispatcher able to know your location?
The short answer is yes. The long answer is it takes a long time. So they gotta go through cell phone towers, they gotta ping your cell phone. So if you know your exact address, that is great, because then we can get right there. If not, it's gonna take a little bit, and then it's it's not an exact area, but it's in the general area. So if you live in a condo, it's gonna give us the condo, but it's not gonna tell us what unit it is. Another thing a lot of people have is life alerts too. Yep. So that, if you do push it, that's gonna go to 911 center or the alarms center.
Goes to Phillips Life.
Yep. And then they'll actually call 911, and then they'll tell us exactly.
Will they
where-
know where I am?
Yep.
What about OnStar? Do they know where I am? Have you used OnStar, or?
Yes.
Cause I got that in my vehicle.
Yes. So there's a GPS location in your vehicle, so in the center console, there's actually a little black box that keeps track of all that area. It'll kind of give you the, not an exact area, but the general whereabouts of where it's at.
Okay.
Yeah,
Where do you look most often for the file of life in the house?
usually the refrigerator.
Okay, and then, does it pay to carry one in the car? Do you guys ever look for one in the car?
I mean, that is a good question. Usually no, but if you carry one in the car, I mean, it would be great.
I mean, if you're alert, I guess you can say,
Right,
it's in my
right.
glove box.
Usually, if we got time, we'll look for it, but if you're serious where you're not alert or whatever, unfortunately, we're not probably gonna look for it. We're probably gonna have other stuff that we're gonna be doing. The engine crew will probably look for it, but as for the EMS, our main concern is you as a patient, and then we're just gonna go from just assuming everything and just kind of narrow it down from there.
So that, like, if I go to UW Hospital, they have all my records anyway.
Yep.
So what is the value of the file of life to you guys?
So for the file of life is value for us, so if I know you have heart conditions, that's gonna be one of the first things I'm gonna look at. So I'm gonna start checking off any cardiac issues. Diabetic, we're gonna check a blood sugar. Respiratory issues, we're gonna start going down that thing. There are some medications that work better for different medical issues. And then there's some medications that if you have XYZ, well, we really shouldn't be giving you this medication because it may counteract it. So it kind of it helps us treat you. It's not a necessity, but the more information we can get, the better we can treat you and kind of make you start feeling better in the back of the truck.
So sometimes people refuse treatment,
Yep.
right? What happens, what role do you guys then play in that? I mean,
So we'll do everything like we normally would. We can't kidnap you. We can't make you go to the hospital. If you were ANO ×4 able to answer all our questions, you have every right to refuse. We are gonna highly recommend you not refusing, just because for us, it's a lot of liability, because if, let's say, something happens to you 2 hours after you leave, and it's just like, well, we were the last ones to see you, so now it may fall back on us. So we try not to have you refuse. Unfortunately, if you want to refuse, we can't, like I said, we can't force you to go to the hospital. But we are going to go down a bunch of different paths. Well, if you refuse, this could happen, this could happen, this could happen. Otherwise, you need to watch out for this symptom, this symptom, this symptom. And it goes, if we sign all the refusal paperwork, we're walking out, we're in the truck, and you decide, hey, I want to be transported, we're gonna grab all our stuff, come in, we'll transport you. We don't care. We're gonna transport you if you want to transport, and if you don't, we can't force you.
Can you get into the doc, they use this My Chart?
Yep.
Can you get into that? 'Cause that has-
Unfortunately not.
Oh, okay.
So what you'll also see is, as we're working on you, we're working on a computer as well. So if you've been transported by us within a couple months, we can actually search your name, date of birth, all that, and it'll actually bring up everything we got from your last transport.
But you can't get into the.
Correct.
Even if you're given the password?
Yep. Even if so if you have it on your phone,
Yeah.
and you get it into MyChart and hand it to us, if you want us to look at it, yes, we can absolutely look at it. But as for us just to go in and access it, we have no access to that.
Okay.
so what determines when you're using all lights, sirens, full board versus, let's have a nice leisurely ride?
Yep, okay. So when we initially get paged out, we get a code of Alpha, Bravo, Charlie, Delta, Echo, or Omega. What that means is, as you call 911, there's going to be emergency medical dispatcher. They're going to be asking you a bunch of questions. And depending on how you answer their questions, kind of dictates how we respond to the scene. So if it's an Alpha or Omega, that's kind of the lower of the stuff. So we're going to come, no lights, no sirens, unless you live up in Wabisa or We get called to Stoughton quite a bit too. We'll go lights and sirens just because of the distance. We don't want you laying on the floor for 15 minutes while it takes us to go normal versus if we go emergent, we might get there a little quicker. Bravo is more so our discretion, just because it may be something serious, it may not. It really depends on that. It also depends on time of day. If it's middle of the night, chances are we're not coming lights and sirens unless it's really serious, just because we don't want to be waking you guys up. I'm sure you guys want to be sleeping. Charlie, Deltas, them are your more severe cases. Charlie is a little less than Delta. Deltas are usually severe respiratory distress, cardiac, chest pain, that sort of stuff. And then echoes are the worst of the worst. So that's our pulseless non-breathers, and you are gonna get everybody that we have at the station. And then we are gonna be making the most noise there. Transport, 90% of our transports are no lights and sirens. If we have to transport lights and sirens, it's a bad day for you, because you are very sick. And so any STEMIs or heart attacks, true heart attacks that we can confirm, then we're going emergent. Any strokes, them are going emergent. Pulseless non-breathers are different. So pulseless non-breathers are different as in we're gonna come there and we're gonna work you on scene. We're not gonna just load and go. We can do everything that they can do at the hospital. So we are gonna try and get pulses back. We're gonna be doing CPR. We're gonna do airway, intubate, give all the same medications. And if we get a pulse back, we're gonna transport. If not, then unfortunately we'll turn it over to PD, and then the medical examiner will also be coming out. With the PNBs too, if you have any loved ones or whatever that have DNRs, for us, the patient has to have a DNR bracelet on. If they don't have a DNR bracelet on when we get there, it is voided. Just because we can't confirm that it's actually valid. If they have paperwork, we're gonna start, but we're also gonna be calling our online medical control to verify it. But until we can get verification, we're gonna work it as well.
So if you're serious, you should get a bracelet.
If you are serious, yep, you should get a bracelet. So there are 2 bracelets for us that are valid. So one is that little plastic bracelet, and then the other is a metal one.
It's got to have the actual.
Yeah, and I can't think of exactly what the brand is, but it's a certain brand of metal DNR bracelet that is valid. So,
Is the information in code on the bracelet?
what's that?
Is the information on the bracelet, is that coded?
No. So there'll be different bracelets. So on the back of the bracelet, or on the front of the bracelet, it'll have like a Star of Life. On the back, it'll just say DNR, name and then DNR. There are also other medical bracelets out there that have diabetic, cardiac issues as well that are also helpful. Did that answer your question? Okay.
Do you have to go?
Nope, not yet. So we are all on the engine. So we actually got another crew back at the station that's on the ambulance. We have one ambulance staffed 24/7. We also have an engine staffed 24/7. Have at least 2 people on the ambo, paramedic and either an EMT or EMT basic. Sometimes we have a second medic. Then the engine is kinda up in the air. So some days we'll have 3 people on the engine, some days we'll have 4 people on the engine. And then if we get a second ambulance call, 2 people go onto the second ambulance, then we either have 1 or 2 people on the engine. So it's kinda up in the air of how many people are gonna be on the engine. There's really nothing set in stone. Fire and EMS is what we like to say, it's very fluid. as in nothing's black and white, anything can change at a moment's notice. So,
How far territory you're talking about going to Edgerton and so on, how far do you guys cover?
how far do we cover? So we cover to the west, what is it, Judd Road, Gray Owl Court, that area. To the north, we actually go clear up to Lake Wabeesa. It's kind of weird because like you get on the other side of McDonald, that's actually Fitchburg's district. And then you go up Highway MM, everything to the west is Fitchburg, and a lot of it to the east is Oregon's. To the south, it is down to about Rome's Corner area. And then to the east is about to Eichster's farm. At the medic level too, we also provide a bunch of intercepts. What that means is Stoughton has a call and they're at the AEMT level and they have something serious where they do not feel comfortable taking it or it's above their skill level. They will call us, we will actually go to them. We'll either meet them on the way there or we'll actually go to the scene, whichever. We'll grab all our bags and we'll hop in the back of their truck. We'll start doing our assessment, our skills, and we'll transport in their truck. Then one of their members actually drives our truck back. We'll intercept with Stoughton, Brooklyn, Evansville, Albany. Them are the main ones, but anybody who calls for an intercept. Comm center will look at who's the closest medic unit, and they'll page out the closest medic unit. That's it? Okay. So, we also do mutual aid. So Stoughton, they are very busy. A couple days ago, they had like 5 calls going on at once. So we'll actually leave Oregon and we'll go to Stoughton, we'll go to Brooklyn and provide additional EMS service towards them as well. Go ahead. You want to answer?
Rush, so you on local fire station. Fire station representative, go ahead. Are you still in your class? No, Captain Lee, myself will go on the EMS call.
Where was I? Mutual aid, yeah, so we'll go, we'll provide mutual aid coverage as well, so. Any other questions?
Well, you introduced the three of you and then you each like had you're in a level.
Yep.
And so could you explain just, I don't want to keep you from your work.
Oh. We're here till 6 a.m., so. Lance here and Aiden, they're both interns, so they're learning the ropes. So what that means is they actually live right at the station. We have 3 shifts, A, B, and C. So these guys are on A shift as well as I am. So Lance here is brand new. He is 18 years old, just graduated last year, has no certs whatsoever. So he lives at the station. Oregon Fire is paying for all his schooling. In his, and then, what's that? Just so yeah, so he is learning. Aiden here, he was brand new last year. He is a year into it. He came to us with no certs. He got his EMT and firefighter level. So EMT basic is the baseline EMS or level that you can have to work on an ambulance. So that's pretty much vitals and a handful of medications. Aiden is now going through AEMT level. So what that means is he can give a couple more medications and he can start IVs. Basic is 160 hours. AEMT is
Pretty close to that, along with clinical.
about 160 hours as well. And then there's my level. I went paramedic level. I've been doing this for 20 years now. Started in Greene County and then came up here. My class was about 2,000 hours, just as schooling. I can give, 30 some medications. There's a bunch of procedures I can do as well. That's not including all the clinical time. I had additional about 2,000 to 3,000 hours worth of clinical time as well. So it's not a short time, and that's above all that schooling as well. So it's pretty much the highest level. And then it's now every 3 years we have to get recertified by the state as well. So we gotta do continuing education constantly. We're constantly training to keep up our certs as well, because everything is changing. There's new procedures, new improvement procedures, new medications, all that stuff. Yeah.
So about 50 years ago, my husband and I volunteered on the Oregon service here.
Yep.
And I think we had 6 hours of training. And
Yeah.
all we could do was throw somebody in the back and go.
Yeah.
That was it. Yeah.
Yeah, it's really changed over.
Yeah, that was when I think back to what we were doing, it's like, wow. But at that time, and it was all volunteer.
Yep.
We had chiefs and-
Yeah, so trying to find a volunteer service anymore is really not around anymore. You go up north, you might find some. There's a couple down in the south area, Greene County, but most of them are part-time or full-time. Yeah.
The training, you actually go to a school or class?
Yep.
Okay.
Yep.
Where is that located?
So there's a bunch of different across the state. There's MATC, which is up in Madison, which is where they're going. I went through Blackhawk, which is down in Janesville. And then for my paramedic, I went through Janesville Mercy out of the hospital down there. But there's a bunch of different technical colleges that actually teach all these courses. Other than that, there's a couple other training that are put on by fire departments, but most of them are through technical colleges.
How do you assess if somebody needs a neck brace or a back, be on the board?
Whether they need a neck brace or not. So if you fall or in a car accident, we're gonna be asking you, do you have any head, neck, or back pain? We'll ask it just to say, if you say yes, okay, that automatically tells us you're probably gonna get a neck brace. If not, we are gonna do a head to toe assessment. And what that entails is, so Aiden is here, I'm gonna go, you having any pain up here? And then just slowly work down the neck, the back, and kind of go from there. What we are doing is we are listening for you to kind of scream out in pain or say ouch. Any wincing, anything like that, that kind of tells us, yeah, you're having some pain, but no, I'm not gonna tell you. Because we'll have some patients that actually say, no, I'm not having any pain. We go to move them and they wince and just like, well, we can tell you that you're having pain, so we'll try and alleviate that. If you fall, you're having a lot of pain, at the medical level, we can give you some pain medication to kind of help you with that as well.
How do you, is it on the same reality of what you just said for people put on the backboard?
Yep. So rarely do we put people on backboards anymore. Most of the time we'll put people on backboards if they're in a difficult location. So we got what's called a scoop stretcher. It actually breaks into 2 pieces. So if you are laying on the floor, you got a broken hip or whatever, we will use the scoop stretcher. We'll give you some pain meds. Kind of put the scoop stretcher underneath you. We'll lift you up. So the reason why we use a scoop stretcher is we're not moving you as much. We don't have to roll you completely. We can just kind of sneak it in there, connect it. We'll get you over under our cot and we'll take you off the back scoop stretcher. If you were in a severe car accident, you're not responsive or whatever, chances are we're going to put you on the backboard. If you're having head, neck, or back pain, we're probably going to put you on the backboard. Whether we keep you on it depends on what we're all finding for injuries. Reason why we're not putting people on backboards or leaving them on the backboards as much is we're finding that as you're on the backboard, you start to have skin breakdown, and it's actually worse for the patient in the outcome. It's a great tool, but we don't use it as much.
Yeah, so in other words, it's keeping down the back, respiratory situation.
Yep. So, we'll also use it, so if you're on second floor or basement, we may just use it just to get you up out of the basement. It's easier to use a backboard versus what we call as a mega mover. It's just a sheet with a bunch of handles on it. But the backboard is just more stiff and it's easier to pull versus a sheet. Any other questions?
Oh, I got one more.
Yeah.
This is interesting. So, like, I live in a neighborhood where we all take care of each other.
Yep.
You know, and everything, so when the ambulance comes to our street, you know, we all wanna, you know, find out what's going on or help. Or maybe at a car accident, you get bystanders that maybe were already there,
Yep.
whatever. So, what do you do with bystanders, and what should a bystander do or a neighbor do, if anything?
It really depends on the call. We'll come in there, we'll find out where the patient is, and then we'll start asking bystanders if they know what's going on. Some bystanders are very helpful, other bystanders are not. If they are not helpful, we'll just kind of shoo them away. If they're helpful, we'll ask them questions. Usually we don't have them help move a patient or anything like that, just because you do that, you could get injured. We don't want you guys to get injured. That's our job. We got more resources too if we need that we can call to help lift the patient. So, I mean, it really depends on the call. Sometimes we'll utilize the bystander, sometimes we won't. It also kind of depends on how serious the call is as well. It may be we'll come and pick them up, we're asking questions. We may not look like we're paying attention, but we are paying attention. We've gotten used to multitasking quite a bit throughout the years. So it really depends on the scene.
And family members aren't allowed to go in the transport anymore, right?
No.
Okay.
So we like not to transport a family member just because depending on what we're doing, if we get in an accident, that's just more liability on us. But we most definitely will transport somebody up in the front seat. They can't ride in the back. We also kind of look at, well, do you have a ride home afterwards? Because we don't want to take you guys both up there and then all of a sudden you don't have a ride back.
Yeah.
And
if I think I recall a couple situations where maybe the exact hospital wasn't determined until you were in the ambulance.
Yep.
You know? So then, how can a family member find out who's left, you know, in the kitchen?
So
where
a
they're
lot of
going?
times we'll kind of get the family member's phone number if it's not really serious. Otherwise, unfortunately, it's usually before we leave. If we don't know what hospital we're going to in the house, before we leave, we usually try and touch base with whoever's in the house or whatever. Hey, we're going to this hospital. If it is a critical call where we are moving fast, we're not really asking where you want to go, that's because we aren't going to UW. We're not going to Merger. We're most likely going to be going to St. Mary's. Reason being, that's the closest hospital. UW is a little further away. They're still a level 1 trauma center, which means they have everything pretty much under the sun. They can treat everything. St. Mary's is also a level 1 trauma center, or a level 2 trauma center, excuse me, which means with enough notice they can do pretty much everything UW can do. But it's 5-10 minutes quicker to go to St. Mary's versus St. Mary's. So if we have a patient that is kind of going downhill on us, we would much rather go to St. Mary's, get them out of our truck, get them into a more controlled area, more resources to take care of them. Versus us that Yeah, we can do everything that they can do in the ER, but our resources are limited. So sometimes it may just be me in the back of the truck working on the patient. Some days it may be me and Aiden working in the back of the truck. There's not a lot of room, it's bumpy, we're also seated. Standing up in the back of the ambulance is not great. We don't usually do CPR in the back of the truck manually. We have a machine which is called the Lucas machine. It looks awful. It's a big yellow machine that goes over, and right in the center is a big plunger, and it goes down and it actually does our chest compressions for us. It never gets tired versus us. We get tired after about a minute or two of CPR. It is exhausting. That doesn't get tired at all, so it makes it a little easier, but it's still, we're bouncing down the road, and it's, for us, driving emergent is a lot more dangerous for us than driving non-emergent. So, yeah.
Do you still call a hospital or not?
We do.
Okay.
So on our way to the hospital, we're usually, for me, I'll say, hey, FYI, I'm gonna be talking to the hospital, talking about you, let them know what's going on. So we'll actually call on the radio, talk to the hospital over the radio, give them a heads up of what we're bringing in, what we've done for you, and then give an ETA of how long before we're at the hospital. Stoughton is a little different. Sometimes they'll answer the phone, sometimes or the radio, sometimes they won't. So if we can't get a hold of them on the radio, we'll also get a hold of them on the phone. Or if we need to have more private conversations, we'll go over on the phone versus the radio. Just because we can ask different questions on the phone that we can't over the radio. So, yeah.
Now, if you have a patient you encounter that's not in, let's say, they're falling and they're all out of position and that.
Yep.
How do you go about to get them straight and prone so that you can work on them?
Very carefully. That's where we'll have different people come. And so if you've fallen and you're kind of not really sure if you're having head or pain, we'll have one person just dedicated to the head and neck, where they'll be holding that. And then the other person will kind of grab the shoulders, another person will grab the hips, and on a count of three, usually the heads count, we'll go 1, 2, 3, and we'll move them. It's a whole teamwork effort. We don't just move you. If you're not complaining of any head, neck, or back pain, depending on what we're finding on our assessment, we just say, hey, do you feel like you can sit up? We'll set you up. How are you feeling after we sit you up? If you're feeling good, we might try and stand you up. If not, we got a bunch of different tools that we can help you get up. If your house is very narrow, we got a special chair that's on wheels that we can sit you on. It also has tracks so we can go up and down stairs as well. Going downstairs is a lot easier than going upstairs. Carpeted stairs are a little harder. Wood stairs are great, but yeah. So. Any other questions?
I need to play yoga. You guys have been awesome.
Is that chair got the rubber tracks on it?
Yes. Yep. Yep. So it's got rubber tracks and then 4 tires and a bunch of straps, so that way you don't fall out of the chair. The biggest thing is if you're in the chair, we'll explain everything, but we'll put the straps on and we'll say, give yourself a big hug and don't grab out for anything. It is a very weird feeling. As we tip you back, everybody's first instinct is to reach out and grab something. Doing that, it actually hurts us, as in it's harder for us to move. A lot of people, once they get that, they're scared and they latch on. And if we're in the middle of a staircase, it's going to be hard to get you to unlatch and then continue down the stairs. Any other questions?
So your organization is not volunteer?
No. So we have 6 full-time staff, a paid captain and a paid full-timer. We also have 2 chiefs, our main chief, or our fire chief, and then our deputy chief of EMS. They're also full-time. And then everybody else, and it's what, 6 interns? So they live at the station, there's 2 interns per shift, and then everybody else is part-time staff.
So if you need additional staff, and they're home, you contact them.
Yep, so our shift, I mean, us 3 up here, our shifts are 24-hour shifts. Most of our part-time staff, it's 12-hour shifts, either 6A to 6P or 6P to 6A. But our shift is usually 6A to 6A. Every once in a while, we'll do multiple shifts where we may be 48-hour shifts. But usually it's 24-hour shifts.
Will you need to expand in the future, or another station, or you gonna take over Village Hall, or?
I have no clue.
No, okay.
I know we are looking, what our staffing is kind of short. I know we are looking for additional staffing. I know we are looking at a different station as well. I'm not on the station committee, so I'm not exactly sure what they're looking at, but I know they're looking at a updated station. Just because what we have now, we're kind of at the limit, and just to expand a little more would be helpful. I know Chief has a whole plan of what we all need or whatever, so we just kind of go with what he needs and go from there.
Did you say you only have 1 fire truck?
No, so we only have 1 station. We have 2 engines. We have our village engine and our rural engine, but they can go anywhere in our district. So the village engine is 750 gallons of water. It also has a lot of our extrication equipment. So the reason why that's our village truck is it's a little smaller wheelbase, and it only has 750 gallons. So in the village, we got hydrants. So on a structure fire, we go through water very quickly. We can actually blow through that 750 gallons within a minute or 2, depending on what we have. So we actually need the hydrant or the water supply as soon as possible. It goes on all our car accidents just because it has our extrication equipment, a bunch of our cribbing, and then our rescue jacks as well for stabilizing a vehicle. Our rural operations truck has 2,000 gallons of water. With that is also our water tender, which carries 3,000 gallons of water. So in the rural setting, we have to transport all of our water to the scene. And some of these driveways are very long, so we carry 1,200 feet of LDH, which is large diameter hose line. When our engine gets on scene, we'll drop our hose line at the end of the driveway, we'll drive the engine up there, and our tender follows right up. So when we get up to that house, we have 5,000 gallons of water. Hopefully, we will not blow through that before our next engine shows up. So our next engine will show up, and they'll hook up to the hose at the end of the driveway, and then they'll actually have more tenders come dump water and pump water all the way up to the house. We also have a squad, has a bunch of more extrication stuff, has a bunch of ropes, has our grain bin rescue tube, has our ice water rescue stuff, just regular water equipment, and just a bunch of other tools that we may need. It's also got a big light tower, so middle of the night, it's dark, we can show up, we can put the light tower up, and it turns it into day. We also have 2 brush trucks and an ATV. So the 2 brush trucks, what we actually drove here today, is just an F350 pickup truck with about 100 gallons of water in the back with a little pump in it so we can go out in the fields, put up water. And then our ATV has tracks on it, and then that carries 65 gallons of water. Our ATV can also be a patient transport ATV as well. So when we get on scene, we'll dump all the water, we'll pull the pump out, and then we'll convert it, put a basket on there So if you were on a bike trail or something that's a couple miles or a couple 100 feet, and it's hard for us to get the ambulance or the cot back to you, we'll call for the ATV, we'll bring that out, we'll get you into the ATV, so that way you don't have to walk all the way back to the ambulance. We can actually transport you back as well. So and then we have the 2 ambulances as well, and then Chief has his own truck, and then Chief Jessberger also has his SUV as well. His SUV has all the same medical bags that we have in the back of the ambulance as well. So sometimes if we need help, he'll come out in the SUV and help us as well. So yeah, we have a lot of equipment. There's a lot of training that goes involved with it. So each month, our second Tuesday night is fire training. So everybody on the department comes down and we train from 6 p to about 9 p.m. And it depends on the month what we're training on. This last month we were out at the Oregon Farm Center doing grain bin rescue. We actually buried Aiden up to about his hips in grain, and we had to use our grain bin tube to rescue him out of that.
How does that work?
How does that work? So, as a person sinks, it gives them so much pressure that we cannot pull them out. If they're sunk up to their waist, it's about 650 pounds per square inch, and there's no way we're gonna, so we have all these little panels that we'll put in around them, and then we'll slowly get the grain out from inside the tube, enough to where he can kind of wiggle himself up, and then we'll get him out that way.
So in other words, taking the place of breaking the pounds per square inch up.
Yep, so once we put that tube in, all the weight is on the outside of the tube, and then we can take all the grain out, and then it's literally, your grain outside is here, and your grain inside the tube is gonna be down here.
You know, lately I've been hearing a lot of, in the news and whatnot, about explosions, houses that are exploding.
Yep,
Those are gas explosions, I assume, some of them?
usually, yes.
Why is that so prevalent lately?
I have no clue. So different things that can cause house explosions is appliances malfunctioning. Just get a leak in the line somewhere. It's really hard to say what exactly causes it, but the gas will build up. Depends on how the house explodes, kind of tells us what kind of gas it is. So if we get there and the house is just kind of lifted off its foundation but still intact, that's LP. So LP sinks to the bottom and just kind of explodes. But if it's natural gas, usually when we get page out for that, the house is all over because it rises, fills up the house, finds an ignition source, and blows up. If you were ever in a house, you smell gas, get out, don't turn on any light switches or anything, just leave, call 911. If you ever think that you need 911 or the fire department, I would strongly recommend you call 911, don't call the fire department. Just because if you need help, like a lift assist or something like that, we actually might be out doing a public speaking talk or out on another call, and if you call the fire station, unfortunately there's going to be nobody there to answer the phone call. If you call 911 and we're out on another call, then they're going to start calling in either Brooklyn, Stoughton, Fitzrona, start them coming in. They'll also notify us as well. So if we do have a unit that we can free up, we can start them to that call as well. So just because we're in the village of Oregon doesn't mean that we don't work with any other, so any structure fire, if it's a confirmed structure fire, automatically Verona, Fitchburg, Stoughton, Brooklyn, they're automatically getting paged out, and they're on their way to a call as well. Other than that, or if they have a call, we may get paged and we're going right to their call as well. So the more information they can get at 911 paints the best picture, they can get the correct resources going as quick as possible.
So, like, if you have a back problem,
Yep.
then what you ask them, it depends on what kind of brace you're gonna put on.
For just back pain, if you're just having back pain and you're sitting in the chair, we're probably not gonna put any brace on. We're probably just gonna stand you up, sit you on, and it also depends on, is the back pain that you're having, is that chronic or not? If it's chronic, well, then we really don't have to worry about any new injuries. So if it's chronic, we'll just kind of help you out, try and make you as comfortable as possible and kind of go from there.
On average, how many calls a day do you get?
This came in with our first one.
Depends on the shift. It really depends. Some days, very rarely do we go a shift without a call. On average, I'd say we're about 3, 4. The other day, they actually did, what was it, 9, 10? So it really depends. There's really no rhyme or reason. When the calls come in, some days we're busy in the day and at nighttime, we're not. Or vice versa. There's nothing during the day and at night, we're up all night. So there's really no rhyme or reason. I think we're on track for, what is it, 2,000 or 3,000 calls for this year already. So,
Last year was 1,800.
We're up from last year quite a bit. And then the year previous, we were at the EMT level here. And when we went to the paramedic level, we had a huge spike in numbers of calls. So part of it is intercepts and just otherwise it's just the aging community and just need more help, so. But yeah.
That's, if you get 9 calls a day like that, obviously, you're not able to cover all those. You got help coming in from elsewhere.
It depends.
Really? No.
Yep, it all depends on when the call came in and how much space in between the calls there is. A lot of times, 9 out of 10 times, if our first truck goes out, our second truck is gonna be going out shortly afterwards. But during the night, I've been on calls where I've had 6 calls, and it just, we transport, we go to the hospital. On our way back from the hospital, we get dinged, so we got a little computer in our truck that has all the calls in the county. Dispatch will call us, hey, you guys got another call. Then we'll go to the next call, we'll transport. On our way back, hey, you guys got another call. So it's very interesting. I chose this field just because it's not sitting or whatever doing the same thing every single day. Every single day is different.
So how do you resupply your ambulance then?
So we carry quite a bit of stuff on our trucks.
So for
But-
like these multiple calls and,
Yep.
yeah.
So if we get to a point where we feel we do not have enough supplies, we will call our truck out of service and go to the station and resupply. For medications, a lot of our medications, we will actually resupply right at the hospital. So it really kind of depends on what type of call we're going. A lot of the calls, all we're doing is taking vitals and transporting, making you comfortable. Well, then we didn't use any supplies, so then we can go all day running like that until we run out of fuel. Then we gotta get more fuel. But if we have the more severe calls, then them are the ones that we get there and just like, can we go another call or can't we? Usually P&Ds though, as soon as we transport, we are out of service. Just because for that, it takes a while for us to go back through. So P&Ds are very chaotic. You'll see a lot of people there. It is a controlled chaos, I would say, but anybody looking at it, it just looks chaotic. We'll be going in bags, throwing stuff at different people here. You do this, you do this. And then after the call, it's just like, well, do we have everything? Yes, no, so then we'll go back, we'll do actually a whole big inventory of any bags that we took into the house, make sure we have everything restocked.
What's a B&B?
A P&B, a pulseless non-breather.
Thank you.
So cardiac arrest, yep, or respiratory
I thought you
arrest.
said B&B in it.
Nope.
Okay, thank you.
Yep.
How do you assess somebody that's unconscious?
How do we assess somebody unconscious? So our first thing is we are gonna be looking, are they breathing? And do they have a pulse? From there, it is kind of what are we seeing? Is there any clues that kind of tell us what happened? Did they fall? Did they not fall? We'll do a head-to-toe assessment on them. We'll get a set of vitals. We will put the cardiac monitor on. We'll get a blood sugar, and depending on what all that stuff tells us, kind of depends on what route we go to. If their EKG or cardiac or heart rate looks weird, we're kind of gonna go down probably cardiac issues. If they're kind of blue around the mouth or whatever, or difficulty breathing, not breathing right, we're gonna go more so respiratory with the cardiac. So it's kind of, we'll start at one point and we'll kind of go down this path, but yet we may turn around and go down this path because we get to the end of this road. Well, that's not adding up, so we'll go down this road and kind of go from there. So it's like putting a jigsaw puzzle together.
Oh, I just thought of something. Do you learn have any training in sign language?
Unfortunately, I don't. Do we?
We did.
As of right now, I don't think we have anybody. Language-wise, we have a couple. Otherwise, we got a couple officers that speak Spanish. But it's kind of, language is also one of them. It depends on if they're available. When you get to the hospital, they actually have an iPad that has all sorts of languages that they can communicate. So it's very difficult for us. Sometimes it's just kind of makeshift sign language, just to try and communicate that way. Otherwise, we got pen and paper where we'll write stuff out and kind of communicate that way. Language-wise too, we'll also pull out our cell phone, go to a translator app or whatever, and try and communicate that way. So. Any other questions? No? Well, I thank you for letting us come out.
Thank you.
And if you have any questions, feel free to contact the fire department. We'll try and answer your questions, or if you want us to do public speaking like this, contact the fire department. The chiefs will kind of set it up as well, so. But,
Did a good job.
thank you. Yeah, and if we're ever out and about, at the grocery store or whatever, just, hey, I'd much rather visit you that way than actually on a call. I mean, just because that means you guys are having a bad day, so. I'd much rather see you out and about, so. Okay,
Thank you.
you guys have a good day.
You too.
Glad you're here.